my name is Dr. Mary Larijani, and welcome to Skin the Surface, a monthly segment where we address important topics related to your skin. This show is intended to serve as an educational resource for members of our community. Our hope is that we encourage you to take a more active role in your skin health. We do not provide any personal medical advice, so if you feel like any of the issues we discussed today apply to you, and we hope that many of them do, we recommend that you consult with your board-certified dermatologist for more information. On today's episode, we will be discussing skincare tips for the new parent, guiding all those new parents out there on safe and effective skincare routines, baby-safe products, newborn and infant skincare rashes, and birthmarks. I'm joined today by Dr. Kostelnik. Dr. Kostelnik is a pediatrician and practices at Nemours Pediatrics right down the street in Villanova. Thanks for joining us today.
Thanks for having me.
All right, so let's get right into it. So pediatricians and dermatologists work very closely with each other to manage many different skin conditions, including rashes in particular, in the newborn and infant period of time. And it often takes a team and a lot of close communication between pediatricians and dermatologists to manage these rashes really effectively. So as a pediatrician, you are typically the first one who's going to see a rash in a newborn or infant. So can you tell us a little bit about some of those common skin rashes that you encounter in the newborn period?
Of course, yes. So I act as a general pediatrician at the Nemours DuPont Children's Hospital at Villanova. We see kids from birth to age 21, but you're right, newborn rashes are so common, and they can certainly be a cause of concern for your exciting and exhilarating time heading home with them seeing rashes. So I think one of the most common things that we see, probably the most common thing to talk about first, would be babies heading home from the hospital in that first week or so of life get very dry, flaky skin. Mm-hmm. We often see that when you come to your first pediatrician appointment right after you go home from the hospital. I always think of it as the fact that babies are in that amniotic fluid, and you come out and that top layer of skin has to kind of just naturally fall off. Mm-hmm. And usually we don't recommend that you do anything to the skin, kind of let nature take its course, let that top layer come off with time.
Yeah, that's definitely one of those newborn rashes that you don't need to worry. Everything will be okay.
100%, yes.
Yeah.
There's another common newborn rash that comes to mind that has a funny name, a scary name that's actually not scary in real life. It's called Erythema Toxicum. And a large amount of babies have that in that first week of life. They'll get little tiny red splotches with a little almost red pimple in the middle that could almost look like a little tiny whitehead in the middle. And parents will see that often right after birth or within that first week. And again, it's another one of those baby rashes that will self-resolve, go away by the first week or two, and is really of no cause for concern either.
Yeah, that's great. So not always something to be worried about, but these are a couple great examples of things that are definitely something that's nothing to fear, but always a good thing to ask your pediatrician in those first weeks.
I think is a good rule of thumb for newborn rashes is certainly talk to your pediatrician, and if you have any concerns, but especially if your baby has a rash and looks ill or isn't feeding quite right or just does not seem quite right to you, then definitely get in touch with your doctor.
Yeah, that's great. Great tips for the parents out there. Wonderful. Any other rashes that you see?
I think another very common rash that a lot of parents deal with is diaper rashes.
Oh, definitely. I think that's about half of all the rashes that we see as dermatologists in babies.
100%, yes. Especially in the summer months when you're hot and the moisture can get trapped in there. It's a very common baby rash. One of the most common diaper rash cause is just an irritation. We call it an irritant diaper dermatitis. And it basically has to do with the diaper kind of coming in touch with the skin repetitively and not having time to air out. And that'll basically be some redness on the exposed surfaces. Mm-hmm. A couple of tricks for that would be you could apply an occlusive cream, like a barrier cream.
Yeah.
Usually like a real thick one that you could purchase to kind of give a barrier between the skin and the diaper. And kind of letting the baby have some time without the diaper on, which can be hard. But if you want to get a nice towel that the baby can lay on, just air that skin out.
Yeah, oftentimes it's just that chronic irritation and rubbing, and it's not the cleanliest environment. So that definitely can be a cause. We also sometimes will see other causes too, like allergy. as well. I don't know if you see that too, but a lot of fragrance, preservatives from the wipes that parents are using, or even dye from the diapers can also cause a similar rash.
Agreed. Sometimes if you'll switch diaper brands, you might even see a change for that, or you can actually get improvement if you change diaper brands. And then I agree with you. Wipes have their place, but sometimes just the act of using that wipe can irritate the sensitive skin. So especially if you do have a rash, I recommend just using a paper towel or a nice little soft washcloth to wipe the skin off.
Mm-hmm. That's great. Perfect. Any other rashes?
So I guess it bears mentioning also, because you can have normal diaper rashes, but you can also have yeast diaper rashes, which the reason I kind of bring it up is yeast likes a warm, wet environment. So a diaper is a good setup for that, but also during the summer months, we see a lot of those rashes. Mm-hmm. So parents will see kind of like an angry red skin more in the creases of the baby's diaper area, as opposed to the kind of like exposed surface. And it can start to spread out in little dots that can kind of extend away from the creases. And that I do recommend that you talk to your doctor about. There's some over-the-counter antifungal creams, but there's prescription antifungal creams that pediatricians can prescribe as well.
Yeah, that's such an important point that you bring up, and one that we often harp on as dermatologists too, is that the location is key in kind of trying to figure out the detective work of what's causing the diaper rash. So you're absolutely right. Where the rash is located says so much about what the rash could be. So that's great advice.
Great.
Awesome. Okay, great. Any other rashes you want to bring up about around the newborn period?
So another common one that probably bears mentioning, because we do see a lot in the newborn period, the first couple months of life, little babies will have tiny little milia on their nose and chins. They're little whitish, yellowish spots. They're harmless also. You can kind of see a trend here, but they are basically just a cosmetic issue. They're blocked skin ducts that will self-resolve with time as well. So don't worry if you see those little tiny yellowish, whitish bumps on the nose.
Mm-hmm. Yeah, those often sometimes get confused with acne bumps as well, which I'm sure you see.
Yes, definitely.
Yeah, but again, nothing to worry about.
And you're right. With the consideration of baby acne, we do see a lot of babies with baby acne as well. Mm-hmm. Usually on those cheeks, as you mentioned, and it looks a lot like teenager acne. Mm-hmm. And again, you can probably sense a trend here, but you can take a hands-off approach with baby acne as well. Mm-hmm. We usually don't recommend using any products or soaps or anything like that on the face. Simply taking a wet washcloth and kind of cleansing that face once a day is probably all you need to do for baby acne, because that will resolve once the hormones from mom resolve as well.
Yeah, and really no impact into adult acne, so nothing for the parents to worry about in that regard.
Definitely, yes.
Great. Anything else you'd like to share that you see commonly?
One thing that's not exactly a rash, but that we talk about a lot with parents in the newborn period for that first week or so, and especially like in the hospital, is what's called acrocyanosis, where the hands and feet of newborns will have a little bluish tinge to them, kind of purpley blue. And that has to do with an instability of those little tiny blood vessels in the skin. So especially you come to your pediatrician appointment, you'll undress the baby to get weighed, and a lot of parents will see those little hands and feet get blue as all the blood kind of goes to the important central part of the body.
Yeah.
Keep your baby dressed, when you're in the coolness. If it's summertime and you're in the air conditioning, we just recommend if you see that, you can just make sure they're nice and bundled and warm.
Yeah. Perfect. Wonderful. Now, another thing I wanted to bring up very briefly was, and sometimes we see these in newborns, but oftentimes it's more into the infant period, is things like cradle cap and eczema. So are these rashes that you see, I'm sure, quite a lot?
Definitely. Yes, I agree with you. Probably more, you're right. Cradle cap can be a little bit earlier. And then yes, eczema is, month 2, 3, 4 or so. You see a lot of that as a pediatrician.
Yeah, and they can look very similar too, and there's oftentimes a little bit of overlap, but cradle cap, we usually think about those like greasy scales that the babies and the newborns will get, or the infants on their scalp, but you can also get it kind of in other creases and areas of the body. And then eczema as well. So eczema is we could talk the whole episode about eczema, but babies who have very dry skin and start to develop these types of kind of weepy rashes may have a little bit of that component of eczema going on. So other things to think about.
And I think it's good to think about the fact that adults with eczema can sometimes have it in different places than babies. A lot of babies will initially develop eczema on their faces. Mm-hmm. They'll get that dry kind of red skin on their cheeks. And then usually their arms, like kind of like the backs of their arms, that kind of thing.
Yeah, it's so true. Again, like location is key in diagnosing skin conditions in babies. So that's great advice. So, okay, great. So let's kind of like transition a little bit. And you already started to kind of touch on this a bit, but kind of the general approach to newborn rashes, and any tips that you didn't already mention, or any tricks about what parents can do at home to kind of manage these skin conditions.
So I think for the few that we mentioned that you can take a hands-off approach, yes, just kind of let the skin in the first week or so let their baby's skin acclimate to being outside the womb. I know we talked about diaper rashes, using occlusive creams. I recommend thick ointments. So those clear ones that can be a little oily, but they work really well to kind of provide a barrier between the skin. Mm-hmm. And then baby acne, as we kind of alluded to, also you can leave that alone. With the mention of cradle cap, that seborrhea in the scalp, we often recommend leaving alone if it's not a lot of area of the scalp. And if it's not bothering you, you could just leave it alone. But you could also take an oil-based product as well, baby oil, even things like olive oil and coconut oil, and massage that into the scalp and take a little brush or a toothbrush and kind of flake those flakes off the skin.
Yeah, gentle exfoliation is key.
Great. Yes.
You don't want to scrub and rub, but yeah, very gently that's exactly right. That's a very good trick to kind of get rid of some of that scale, because it can really kind of pile on and build up if you're not kind of doing a little bit of work to get rid of it.
Good point. Yes.
Yeah. Okay.
Sometimes you have to stick with it. You have to do it once a day or so.
Yeah, I know. That's one thing. And we can also kind of discuss this a little later too, about like just general skincare. But, sometimes parents are nervous to bathe their baby too much. But as long as you're bathing and following up with moisturizing, that's the key component. It is safe to kind of wash the hair every single day to kind of try to get rid of some of that built up debris from the rash. So that's a question we often will get asked too.
Great. Right. Yeah, I think it's important too to think about that your baby in the first couple months doesn't really do much to get really dirty. So, you don't need to bathe super frequently, but I agree in that hair, especially if your baby has a lot of hair, you can do that more often.
Yeah, exactly. Right, great. And then when in doubt, if you're trying these, methods and they're not working out for you, then that's really when you want to talk with your pediatrician or your dermatologist to kind of see if, something's being missed or, maybe something more is actually needed. Sometimes we actually do use medications, topical creams for babies who have, persistent rashes, or like you mentioned, if those over-the-counter yeast creams aren't working, sometimes you really need to bump it up to prescription grade. So when in doubt, definitely have your doctor check it out, is always my motto.
Definitely.
Okay, perfect. So, we talked about rashes. I kind of wanted to transition a little bit into other skin conditions that will be brought up in that newborn period of time. So another common issue that parents will encounter are birthmarks, as well as moles. And so oftentimes parents aren't sure if the birthmarks or moles are spots they should be worried about, and often will come to their pediatrician, with these questions. So can you tell us a little bit about some of the birthmarks that you commonly see in the newborn and infant period? And at what point you think maybe something more would be done or when they should see a dermatologist?
Great. Yes, of course. So I think the most common one that comes to mind is a simple one, nevus simplex, where babies will get what's kind of anecdotally called a angel kiss on the forehead or a stork bite in the back of the neck. I usually kind of joke to my patients that, if it has a cutesy name like that, it's not dangerous. And they're little splotches. They're little red splotches between the eyes or on the eyelids. And they are just little dilated blood vessels in that top layer of skin. You could see it through that thin skin of the face. And then they'll fade with time. it's one of those things where you'll see your baby cry and the blood vessels will become brighter. You'll see it more. You might be a 2-year-old that cries. You might see a little splotch on the forehead, but they do usually resolve with time.
Yeah. Yeah. And that's really important to note. And like you said, most of the time they'll fade, but then, with like emotions or increased pressure, you might even notice them still. But those are very common. We see them even in adults, when we do our skin checks, some of them still are a little bit persistent, but if they're ever very large or crossing a large portion of the forehead, or maybe kind of dipping down into the eye area, maybe something that you'd want to have checked out just to make sure it's not anything else.
I agree. I think they can sometimes be confused with port wine stains, which usually kind of same idea. They're flat, red, cover a large portion of the skin, a little bigger than those little tiny splotches for the angel kisses. And I agree, as pediatricians, we'll kind of make sure it doesn't cover certain parts of the face and utilize our dermatology colleagues if so.
Yeah, wonderful. Great. What else have you been seeing?
We see a lot in babies that have extra pigment to their skin. We see like a dermal melanocytosis, where there's almost like a bruising color to the skin, usually at the base of the spine, but it could be other parts of the body too. It's actually very prevalent in babies who have darker skin tones, and those are just certainly extra pigment cells that get deposited there. And I think it's important to bring that up, because if you see that on your baby's lower back, anywhere else on their skin, your pediatrician can document it in their chart, so it's not confused for a bruise later in life.
No, that's great. And just like you had mentioned before, sometimes they fade a little bit over time. Sometimes they're always a little bit there, but yeah, that's great for that purpose, because it's very commonly, especially if you don't know what you're looking for, confused with something else that would be a little bit more concerning.
Yes.
Yeah.
And I think a birthmark that can certainly be a little bit more worrisome to parents are hemangiomas.
Yeah.
And a lot of times we will utilize dermatology if we see hemangiomas, especially if they're large or on the face, near the eye, that kind of thing.
Yeah.
So those are, sorry.
I was just going to say, can you explain a little bit about what a hemangioma does or what it looks like?
Of course. So those are the larger collection of blood vessels, and almost will look like a cherry or a strawberry that's kind of protruding from the skin. They can be under the skin too, where they get that little bluish, purpley twinge to them because they're deeper in the skin. They might not stick out. Mm-hmm. And you'll see them over the first few months of life actually get a little bigger as those blood vessels grow a little bit. And then usually around 6 months or so, they'll start to shrink up and kind of resolve into themselves. But we do like to pay more attention to them if they are on the face, they're more of a cosmetic concern, or if they're around the eyes, the nose, the lips, or if they're especially big.
Okay. Yeah. And that's so true. And sometimes they can almost look like those other types of, spots that we were talking about before, like almost just like a little patch of color that, rapidly starts to grow. So definitely if it's changing, that's something you want to let your pediatrician know about.
Definitely, yes. And another thing you could do is take pictures at home, and usually as a pediatrician, we'll take a photo in the office and we can always upload it to digital charts so you can follow it with time.
Oh yeah, that's great. I know now technology allows us to have everything captured through digital media, which is great. Okay, great. Any other spots that you wanted to mention that you noticed in the newborn period?
So rash-wise, I think we covered everything. Is there anything you can think of?
I would say the only other thing I could think of is sometimes babies, some moles actually are congenital, and babies are born with some type of moles. And so sometimes parents will get very concerned and say, what do I need to look out for? When should I be worried? Do you guys commonly see?
That's a good point. Yes, because you can get some birthmarks, or some people call them moles, in the newborn period, and they can actually come a little bit over the first few months of life as well. Yeah. And I like your idea of monitoring them for change. If you notice that the color is changing a lot, if there's multiple colors in the same mole, or if they're growing very rapidly, that warrants calling your doctor.
Yeah, absolutely. And we have like tons of mnemonics that help us remember. But, the most important is any change. Larger than the size of a pencil eraser, you may want to have that looked at. But most important to know is that any sort of skin cancer or melanoma in a baby is extremely rare. So likely most areas can be monitored and treated conservatively.
Great, yes.
Perfect. Okay, great. So we've discussed some common skin conditions and how to navigate these with your pediatrician and dermatologist. But how about just some general skincare information for these new parents? So we often get asked, particularly our new parents, how often should they be bathing their newborn? What products are good to use? How do you know if something's going to be safe on the newborn skin? So to start that all off, can you tell us a little bit about some of your bathing tips that you give the new parent?
Of course, yes. This is a great topic because I think a lot of parents, especially for first-time parents, it's hard to bathe that little kind of like wiggly baby. So I think in that first week or so, you do want to wait until the umbilical cord falls off or for any circumcision to heal up. And in that first week and a half, you're just going to do a little sponge bath if need to, around the spit up areas or diaper area if need to. And then after that time, I usually recommend bathing your baby about 2 to 3 times a week. I do recommend a couple practical tips. One is to kind of have everything ready for your baby. You don't want to be looking for the towel and not be ready to have that baby put somewhere. Mm-hmm. And then really make sure you get in the creases, under the arms, that kind of thing. I also find a lot of families worry about babies' ears, but you actually don't really have to worry about getting water in the ears that much. That eardrum is going to protect the ear. The water won't get in too far. So if you have a little splash, don't worry too much.
Yeah, that's all great.
And then I think I usually recommend using baby products that are pretty hypoallergenic and fragrant free. Mm-hmm. I think it's very appealing to buy those nice smelling products, but my usual general rule of thumb is that they can sometimes irritate that sensitive newborn skin. So you want to kind of use a product that doesn't really have much scent to it.
Yeah, that's great advice, especially for the babies who, are more prone to getting eczema or have that family history. Their number one reaction is most likely going to be from fragrance. So although they make your baby smell good and they're cute and adorable, it's probably best to limit that. And that's often our recommendation as well.
And I think that baby smell is good anyway, so they don't really need it.
It's true. And then I know we kind of touched on moisturizer before, but what do you usually recommend for that?
So I usually recommend an ointment-based moisturizer, and I know you already alluded to it, but right after bathing, kind of lock in that moisture from the bath time. So pat your baby dry, and while they're still a little bit glistening from the water from the bath, just coat them in an ointment moisturizer, like a petroleum jelly type moisturizer.
Yeah, we actually term that soak and smear. I don't know if you use that terminology as well, but yeah, you just soak them in the tub and then you smear on that good moisturizer when the skin's still a little damp to kind of really lock everything in.
And I think babies who have more sensitive skin, if they have eczema, you can certainly use those more often, 2-3 times a day, but definitely after the bath.
Mm-hmm. Wonderful. Great. Perfect. So then any other tips you wanted to throw in there, but I think we kind of hit it all: the bathing, the washing, the moisturizing.
I think that's about it, with the idea of knowing that once your baby starts solids, you might have to change your routine a little bit. You might be getting more messy, but that's good for that. First few months is good for that.
Yeah. Okay. Perfect. So kind of to piggyback off of that, so searching for safe products for newborn skin can be really daunting, particularly, again, for our new parents out there. So especially when you consider how many products are out there, they're marketed as safe. We've kind of started to touch on some of the elements, but can you tell us a little bit more about, what you look out for babies who particularly have dry, sensitive skin, like maybe our eczema-prone babies?
I think a good rule of thumb is the fragrance-free. Yeah. If it smells like lavender or smells like something, stay away from that. And looking for an ointment as opposed to a cream. I think that can be confusing, but ointments are, like we said, the ones that are clear. And then the creams can sometimes have other components in them to stabilize them that are white consistency. They're not as well soaked into the skin, I don't think, and they can sometimes cause a little bit of sensitivity as well.
Yeah, that's great. And yeah, so I mean, basically you have lotions out there, creams and ointments. Lotions, it's a lot of, water-based, some alcohols that kind of irritates the skin. Creams, like you said, in order to preserve them, have a lot of preservatives. And ointments are really your best bet. One thing we often get asked by parents is, well, my product I'm using is organic. Doesn't that mean it's good for my baby? What is your thoughts about organic products?
I think certainly there's a personal preference, and if you'd like to use that, you certainly can, with going with the idea of watching out for the fragrances and the scents as well.
Yeah, definitely. Be cautious with the botanicals, because that can really be where a lot of the fragrances are. And one thing I always like to tell patients is, I always remind them that poison ivy is also organic, but you wouldn't want to rub that on your baby's skin. So just be very cautious what additives are in those organic products.
That's a great point. Yes.
Yeah. Okay, perfect. And just to kind of wrap things up, seeing as we're in the summer months, I just want to transition to a couple final tips for the parents. So particularly questions that come up: what sunscreens are safe? What insect repellents are safe? Are there any recommendations that you like to give for your newborn skin in terms of kind of sun protection and insect repellent?
Of course, yes. So sun protection, we do like to wait until as close to 6 months as possible. And even after that time, try to avoid that midday sun, wear long sleeves, long pants, and hats. And then when you do put sunscreens on your baby, I like to recommend products that are simply zinc oxide. They're usually marketed as the baby sunscreen, but they include the product only zinc oxide, which is just a barrier between your skin and the sun. For insect repellents, down to age 2 months, you can use products with DEET in it. Actually, you want to look for 10 to 30%, and you want to apply it probably on your hands and then to the baby's lower legs. You wouldn't want to put it on their hands just in case they get that in their mouth. And then there's a newer product out there, oil of lemon eucalyptus. That product is recommended after you're age 3 years old, so you can certainly use those for your older kids as well.
Okay, that's great. And then just to kind of piggyback off that, there are some products out there that are combination sunscreen and insect repellent. So usually those are not recommended just because, with the sunscreens, we recommend patients reapply them every 2 hours, but you definitely don't want to be applying insect repellent that often.
Great. Yes. Yeah, I agree with that. And then if you are applying the insect repellents, you'd want to wash off as soon as you come inside once you're done with your day. But you're right, apply sunscreen every 2 hours, I think is that what you usually tell patients as well?
Yeah, and then if they're like in and out of water a little bit more frequently. But yeah, the general rule is, 30 or higher, mineral based, and then reapply every 2 hours.
Great.
Wonderful. Well, do you have any last kind of tips or anything we missed that you wanted to cover?
I think the only last thing I wanted to leave with is be in close contact with your pediatrician. If you have any concerns, like you said, with technology nowadays, you can send us photos of rashes you're worried about. And I think your pediatrician can be a good ally.
Yeah, that's wonderful. Well, thank you so much, Dr. Kostelnik. It was so great that you joined today's conversation about newborn skin and skin conditions. And we really appreciated hearing all of your insight and your personal experience in caring for newborns and infants. So thank you.
Great. Thank you very much. I had a good time.
Yeah. Well, that's all we have for today. Thanks for joining in today's discussion about your skin. We hope that you learned something new. If you like what you heard today, tune into our Skin the Surface podcast available on iTunes and Spotify, or visit us online at skinthesurfacepod.com. See you next time.